pleased to introduce Neli Vazquez Rowland, President and co-founder of A Safe Haven.
Good afternoon. My name is Neli Vazquez Rowland, and I am the president and co-founder of A Safe Haven Foundation. Since 1994, A Safe Haven has been on the front lines of homelessness. We provide one of the most complete and comprehensive solutions to addressing the underlying issues related to poverty and homelessness, as well as advocating for relevant policy issues on the topics of criminal justice reform, mental health parity, the opiate epidemic, and now COVID-19 pandemic. We also provide phased housing approach with a multidisciplinary team of professionals that include individualized assessment, physical, education, workforce, housing needs for our residents. These wraparound services are designed to meet the underlying issues of individuals' needs and provide them with the coordinated care services they need to foster good health, social, economic, and housing stability for themselves and for their families. Thankfully, the vast majority of the people that we serve at A Safe Haven have succeeded in recovery, family reunification, employment, permanent and stable housing. Every year we serve over 5,000 people a year. Our network of transitional, supportive, affordable senior and veteran housing provides people with the level of housing and the level of care that they need based on where they are in life. And I call our work at A Safe Haven truly an elegant solution to a very complex issue. We are proud to be among a network of top-notch leaders in the field who are doing good work on behalf of our most vulnerable populations, many of whom are in this room. I want to thank Mayor Lightfoot for your leadership, your steadfast leadership during this unprecedented time in the pandemic crisis. We've never seen anything like this in our history. For the first time, in our city, we are seeing the issue of homelessness being dealt with on the level of urgency that recognizes it not as just a moral or financial imperative, but truly as a public health imperative for the first time. We are acknowledging how, as a nation, health and wellness of this vulnerable population is truly interlocked with our own. Today, what is happening on the front lines is truly transformative and is uniting the expertise of all the community subject matter experts working on this issue together and as one. In response to COVID-19, I am pleased to finally see the convergence of institutional healthcare experts, homeless experts, and government agencies. We are now working together to create the intentional integration of institutional healthcare with homeless and behavioral healthcare providers. We are now working side by side to provide the homeless with seamless access to the appropriate level of care, housing, and discharge strategies that will no longer land them back on the streets. I know after this, there will be no going back to the old way of doing business. Our community-based residential behavioral health care solution, once overlooked by many, is now becoming a critical part of the emergency response infrastructure. It will create a new norm which will give the homeless access to the dignity and level of care they need. It will help prevent and overcome any of their sudden or chronic health, behavioral health, and economic and housing crisis situations. It is under Mayor Lightfoot's steadfast leadership that we are honored to be a part of and be a resource for this new delivery system. We could not have done this without the collaboration and support of the leadership from the Department of Health, Dr. Awady, in particular Megan Cunningham, who's truly been a blessing. I think I speak for everyone when we say that she's been a blessing for the entire network for both health and homeless providers in listening and offering guidance and support in a way that relies on the true experts that have been doing this. I want to thank the leadership at OEMC and the Department of Family Support Services, Lisa Morrison-Butler, for the role that you are playing to support the collective network of COVID-19 first responders. I met with Dr. David Ansel almost 30 days ago, and we had the conversation of what it would look like to create an isolation space at A Safe Haven, to augment the work that we were already doing on the front lines by converging our healthcare services with our behavioral healthcare services. And within 30 days, we're really proud to say that we now have the city's first isolation space dedicated to serving the health and behavioral healthcare needs of the homeless. We could not have done it without the support of Angela Moss, the Director of Nursing, and Dr. Stephen Rothschild from Rush University Medical Center for their leadership and their vision and helping us create the first, again, isolation space. This initiative will truly help the homeless simultaneously overcome the comorbidity of their health and behavioral healthcare challenges under our respective teams as they convalesce following their positive diagnosis. This is a pivotal time. This is an extremely difficult time for all of us. But rest assured, the hard work is being done, and this is the dawn of a new era for community-based healthcare, and we look forward to becoming a part of the elegant solution that emerges, that will endure for the benefit of all stakeholders. Thank you, and God bless.